the clinical pathology. So the clinicians, if you're going to become surgeons or internists or OB-gynecologists someday, so you will have to work on your diagnosis. And of course, as doctors, to support your diagnosis, you have to do what? First, you have to do a thorough assessment or physical exam to your patient. And then after that, what do you do next? Anybody, you tell me. Shamili, what do you do to your patient? Is Shamili around?
Yes, Doc.
Okay, so what do you do to the patient, Shamili? You take history, right? You take history, what happened to the patient, and then after that, you now request for your laboratory. So the clinicians should first, do you have it there? Can you see this one? Oh, confirm or reject diagnosis after doing the laboratory test. So if you think that it's not UTI after doing a urine analysis or urine analysis, and you see that the cause of the hypogastric pain is actually increase in RBC in males, so probably you will entertain another disease entity. You will entertain renal stone or lithiasis. And then what else? You provide guidelines in patient management. So of course, the clinicians would rely on the results of the lab on how they can manage their patient. It is said that pathologists are actually the doctor's doctor. So if you want to become a pathologist like us, you will not be dealing with patients. You will be dealing with what? Do not be shy to answer because I cannot see you, all of you. If you're a pathologist, you deal with what?
Doc,
Yes? Deal with what?
will be dealing with the specimen in the
Can you still
laboratory.
hear me? You deal with specimens, right?
Yes, Doc.
So we don't have yes. What is it? You cannot hear me.
I can hear you, Doc.
James, ang atong
Doc, here online classes we can hear you, but I don't think the class can hear you.
okay. I think it's my internet who's unstable. Can you hear me now?
Yes, Doc.
Yes.
You were not able to see the list. I think I actually sent it in the chat box.
Doc, we can see it already, Doc.
Okay. You wait first. I'll just transfer my connection to my data. Can you hear me now?
Yes, Doc.
Yes, Doc.
Okay. So the next is the clinician can establish the prognosis of the disease. So when we say prognosis, what does it mean? Why do surgeons need to submit specimens for staging and grading? So what is the prognosis? You can either have a good prognosis or a bad prognosis of, like, for example, a malignant
Course of the disease,
disease.
Doc.
Okay, so if the patient is going to have a chance to live for how many years, or if the patient is going to die in a few months, that is prognosis. Then we have detecting the disease through case finding and screening. So usually the laboratory test that is done for screening, like for example in OBGYN, is the pap smear, right? And lastly, um, laboratory tests are needed to monitor or follow up the therapy or the treatment. So your laboratory testing actually involves three phases. We have the pre-analytical, the analytical, and then the post-analytical. But we have actually to discuss for, like, for example, for the laboratory setup that we have as students, we have the pre-analytical phase and then the analytical phase. That's what we focus on our exercises. So when we say pre-analytical, it's very crucial because you have to have the proper identification of the specimen as well as the patient. Because once you have the wrong identification of the specimen or even the source of the specimen, so the releasing of the result would already be erroneous. So your pre-analytical phase starts from the time the doctor or the clinician decides to request assistance of laboratory in the management of the patient. So the request and the receipt of the specimen by the laboratory scientist. So if you become interns, it is actually your role to submit the specimens to the laboratory. So if, for example, you're rotating in surgery and then you assisted an OR, an operation, you will be the one to send the specimen together with the request to the laboratory. Okay, so we have actually sanctions or demerits for interns who get mistake, or even if it's just it's not intended to be a mistake, just by carelessness. So we still give like a repeat rotation That's actually the grave misdemeanor that we give. Like for example, if you unintentionally misplace a specimen or mislabel a specimen, so it would require you some days, even 1 week repeat rotation to a certain department. So being the captain of the ship, in the case of his or her patient, it is appropriate for the doctor to keep in mind the following. So first, why a laboratory test should be done, putting into request a brief, pertinent medical history and his or her clinical impression. So how would you explain this? Number one, where is Ramesh? Ramesh, can you explain the first one? A brief and pertinent medical history. What is the importance of this? Is Ramesh around? Or anybody who can help? What is the purpose of a pertinent medical history?
To check for the patient's allergy, or to check for patient's past and present illness, so as to check if the patient might have any allergy, or to diagnose if his chief complaint is only about that, or is it due to any other reason that had happened in the past. So before we do laboratory tests, first do the medical history and then do the PE.
Okay. Like for example, let's have a mass in the breast. So what history can you extract from a lump in the breast? So give me a history. What do I need as a pathologist for the history of the lump that you have submitted or the mass that you have submitted to the lab? What do I need?
Family history of breast cancer.
History of
Breast
like,
cancer.
family, you mean family history? Aside from that, what about PE? Do I need to know the location of the mass? What is the consistency of the mass? When you do palpation, is it mobile or is it fixed? From what quadrant of the breast? So aside from that, if there was a lump in the right breast, are there neighboring lymph nodes in the armpit? So as pathologist, actually that's what I need. If you submit to me, what is this? A mass. But if a urine is submitted, so you have to take note also history of fever, the pain. So is it a pain that is from the retroperitoneal area that radiates to the abdomen? Or is there a renal colic pain? Or it is just the hypogastric area? So that I will know if this can be related to stones or these are just cystitis or it's pyelonephritis. It depends. Okay. So that's history or pertinent medical history. Then we have how the patient should be prepared before the collection of the specimen. Like, for example, give me an example of a specimen which needs preparation at night time. Give me an example. Like for example, your lolo or your grandmother or your mother, if they had blood chemistry, like fasting blood sugar, how many hours do they need to fast?
6 to 8 hours.
They need at least 8 hours fasting. But if your lipids are included, you have your lipid panel, so you have to extend for 2 or 4 hours more. Then what is the proper timing for the collection of the specimens, especially for hormones or urine samples? So we have to take note of that. What specimen should be submitted and how to preserve the specimen until its final endorsement to the laboratory. So it's very important. The formalin for what is this? Your tissues before they're brought to the lab, you have to submerge it in 70% formalin so that the cells will not be bloated. When it's exposed to air, so it will become bloated. So once the pathologists look at it in the microscope, they might look at it as an enlarged nucleus, but actually it's just a bloated specimen. Then obtain basic knowledge on how activities in the laboratory accomplish these services. Then, of course, this one is very important. Clinicians should understand the expected turnaround time for each of the tests. Like, for example, if you have the RT-PCR, it's not like the CBC that you can do the test or the procedure immediately. So you have to wait for other samples in order for the entire batch to be processed. And it takes how many? It doesn't take hours, but actually you can have the list is if it's an advanced release, you can have 8 hours, but the releasing should be the following day. So for stat specimen, of course, for critical patients, they have to put on the request the word stat. It's from the Latin word statum, which means it needs immediate processing. But in other hospitals, once a specimen is placed with the word stat, there is actually an additional payment for that. Like, for example, in a private hospital where I was admitted, I was in the ER before, and then the doctor wanted that my potassium result will be released, and the releasing is 4 o'clock. So she wanted it to be released immediately at 1 o'clock. Then I paid an extra for the stat result. So it's costly also to the patient. No? Okay, next. All specimens must be considered infectious. So that's your universal precaution. Fluids, your blood, your urine, it must be considered infectious. So the physician, then the technician, the medtechs, the laboratorians must always wear his or her protective personal equipment. So the gowns, the pair of gloves, the mask, the eye goggles, the shoe cover. So especially now that it's COVID season, so they have to have that proper PPE for biosafety and for protection in the laboratory. Okay. So here are the exercises that we have. Can you see the exercises? So we start with exercise 2 until exercise 19. So all in all, you have 18 groups, right? There are 18 groups. So we have here, the first group is exercise 1, and then the last group, which is group 18, is exercise 19. So you just have to follow the procedures in the manual. That's all that you need. You can either do actual demonstration, like for example, for venipuncture or capillary puncture, you can do an actual demonstration, but for the making of films, you can show videos. Since we lack time, so I have to delegate the task to you so that at least you will be able to have the contemporary awareness of your manuals. Or else, if it's going to be the teacher who's going to lecture everything, so some of the students will just watch, or some may not even know what happened. So we have three kinds of persons: the one who makes things happen, who watch things happen, and who don't know what happened. So I want for Clean Path that you make things happen, and I am the one and the other MEU or junior MEU, including our chair, to watch. So we'll have the supervision, or we'll facilitate, and then you have to do the actual. Okay. So if all all of the students are on full face to face, so at least we will group ourselves, or we will have our grouping. So if we are four in the department and you are 200, so one preceptor will have 50. That will be overwhelming. But anyway, we'll just have it like a live video or an actual demonstration. How would you do that, group one? Can you imagine already what you're going to do for the venipuncture? Did you try to scan on your manual? Because I think for venipuncture, this can be reported on a Monday, not on a Wednesday. Or probably you can report the theory or the procedure on Wednesday, and then for the actual demonstration, if you want to have it, we will have it on another day. Is it okay for the class? We'll just have to make the necessary adjustment because we lack time for ClickPass.
Have you already posted the manual?
Yeah, actually, I already uploaded the manual, but I don't know if you can access on it. It's already here.
So the Monday we will be actually doing the venipuncture.
If Ma'am Gisette would be ready by Monday, but I think Ma'am Gisette is still on vacation, so probably it's on a Wednesday. You can do the actual demonstration on a Wednesday, and if the reporters are ready on Monday for the theoretical, so they can also report it on a Monday after the, what is this, our GenPath lab.
So, as per the schedule, the reporting is Wednesday, but if we are free after GenPath, they will do reporting. And then Wednesday, Ma'am Giselle will be demonstrating the venipuncture so that we will also do it after she teaches us.
Yeah.
It's going to be on a student, right? Not on the demo.
How many are you in school? How many are you now?
Around 40.
40. So if I will be around on Wednesday, then We also have Ma'am Josette and then two junior MEU. So we can just supervise the students. Okay. So exercise one. The general concept, your laboratory request. This is very important. So the importance of understanding the principles for selecting and then ordering most rational laboratory tests on a specific patient. You have to have the current age of managed care, then the medical necessity, and it should be outcome oriented. Before, it used to be a shotgun approach, or I think a machine gun approach, in which the doctor, especially the internist, they order a lot of tests, and this is very, very what? It's very, very costly for the patient, especially if the patient cannot afford that much, especially now that the prices are high. So it's better that we have the rifle approach or the targeted approach. So they have only, or the doctor can only request for the specific type of diagnostic test. At least the ordering is what? It's limited, and then it's not costly. Okay, like for example, if the disease is only um, hypertension, what laboratories can you order for hypertension? Anybody? You have to check everything. Give me tests that you know for hypertension. You have to know that.
Lipid profile.
Okay, so you have your lipid panel. What else? Crea, yeah, creatinine. If there's diabetes with hypertension, so you can order um, fasting blood sugar, then include SGPT also for the liver. What else?
RFT doc.
Chronicity of the diabetes, you can have HbA1c. Okay, so those are the things that you have to consider. You limit the number of tests to help the patient. Okay, so why is the test being ordered? What are the consequences of not ordering the test? So, like for example, if you have hyperthyroidism in a 5-year-old patient, so is it okay to order only TSH, or you have to include the panel, thyroid panel? You have to include T3, T4, and TSH right away, especially that um, the results of your hormones for children, they are actually very erratic. You need to adjust the treatment every now and then. So it's different from the other type of hyperthyroidism. How good is the test in discriminating between health versus disease? Okay. So for screening, um, screening sometimes you can, it's just an annual physical exam. They have incidental finding in pap smear. They can see incidental finding in CBC just by taking the annual physical exam, like for example in companies. How are the test results interpreted, and how will the test result influence the patient's management and outcome. So this is important, especially in diagnosing between a benign and a malignant type of what is this lesion. So, okay, so the answers to these questions above, you have the optimal selection, of course, and then it should be cost effective for the use of laboratory tests so that it can benefit the patient. Okay, so here we have the contents of the requisition form. So have you seen a request, laboratory request? So it is crucial to provide all the information that could be relevant for correct laboratory testing. Of course, it should be legible. Doctors are said to have bad handwriting. So this should be a no-no. So in SOTO, we have calligraphy for doctors so that at least our penmanship can be read. It's readable. So it should be written correctly and then completely filled out. Verbal information done to complete a requisition is discouraged for confidentiality's sake and of course to avoid misinformation. So it should be put into writing. Or else if there's no documentation, if it was not written, so it was not done. So, depending also on the type of specimen, the test may be processed as soon as the laboratory received the completed requisition. However, most of the specimens actually starts degenerating right after collection as your laboratory waits for complete information. Then, like for example, if the request comes late and then the specimen was already submitted, sometimes the specimen gets lost. So it would come in together to the laboratory. You have to bring both the requisition completely filled out and then the specimen. So the information listed below should provide the completeness of your clinical laboratory request. So it has three parts. The first is your patient's demographic, the patient's name. You have the family name first, then follow your surname first, then followed by the first name and then the middle initial or the middle name. Then the age and date of birth. But some requests don't need actually date of birth. But in the hospital, for the tagging, they actually include the date of birth, home address, then the contact number. If it's admitted, what was the date of admission, and date on the examination was ordered, hospital number, room number. Then, of course, for the payment, they have to have the official receipt. Then for your diagnostic information, so you have it there. If it's a tissue, you have specification of the specimen, what organ or what is the tissue source. If there are, like you can put suture as marking of the lateral margins. If there are margins there, you have to put it. And then you also have to have the brief and then the pertinent clinical history. So you include also clinical signs and symptoms if they have previous laboratory tests, and then what is the therapy that is done. And of course, the clinical impression. And the third part, you have the attending physician's information. You have their printed name of the physician. So if you have the name stamp or the TRODAT, so as early as internship, you can have your name stamp so that it is clear, and then your signature should be affixed on top of your name, and then license number, then the contact information or the phone number. Okay, so any questions up to there? None? Because for the remaining hour, we will actually, I will actually let you make a request. So these are example of request. This one. Okay. So can you see the request? Can you see the request, class?
Yes, doc.
Okay, so that's our prescription in Soto. You have to fill out everything, and then there you can put the date of birth if this is admitted, but if it's OPD, okay. So if it's a pap smear, you have to have the diagnosis. Then here's my name and then my contact number. Another one, oh, that's my face. Excuse me. That's not supposed to be the next. What happened? Okay. So here's another one from High Precision. This is how their lab request uh, is. You just have to tick or to check on the test that you want to be ordered for the patient. So you have the surname of the patient, then the first name, middle initial, then the requesting physician, the age. If it's a senior citizen, you can have a PTR also, so that they can what is this have 20% discount. Then you have there the gender. Then this is the diagnosis, and then what test do they need? Okay. So you have to make sure that your penmanship is readable. Okay, so I actually placed an assignment for this afternoon, which is due at 5 o'clock. So that's what we're going to do now. Do you have paper there? Or you can just use your cell phone, the blank document, and then you make your own prescription or lab request. Yeah, lab request, including the diagnosis and then the complete information or the complete um, parts of the requisition form.
Doc,
Can you do it now?
so Doc, we will make two papers just like what you showed us, filling all the information.
No, you can only make one because the one that I showed you is actually the one is just a written request, and then the other one is a type of requisition form wherein you can see all the tests, and then you just have to check. Like for high precision, they have it here. Um, they have the diagnostic test, the certification. Okay, you can just create one because it's due on at 5 o'clock, and then I will check it, and I want you to write it because I want to see your penmanship. Do not encode. So do you still have ball pens with you? Did you bring ball pens? Pencil? Okay, you can use pencil. So you write legibly, and then you can just put license number, any license you want. The number you can have 14344, 1234567, as long as all the parts are there. And then you picture it and then upload it on the assignment. Okay?
Yes, Doc.
So any question?